Hi there, welcome back to my YouTube channel. Thank you so much for joining me. Please remember to like the videos here on YouTube, click the notifications and also subscribe to the channel, and also check out the playlist for other videos to do with cosmetic surgery. So today I'm talking to a lady called Emma from the UK about medical tourism in Turkey. Hi there, thank you so much for joining me today. Please just introduce yourself and just tell me a little bit about the medical tourism business that you've just started.
Hello, Rona. Lovely to be here. Yes, I've just started working for medical tourism based in Antalya in Turkey. Recently came back, had a good view at their hospital, at their clinics, very well organised, very professional, all board certified as well because I've checked them out. And their work is absolutely immaculate as well. So and there's no middleman, so you go direct to the doctor's office, whoever's interested.
That's brilliant. Okay, so just tell me, what clients from where would your clients come from? What countries would they come from?
My clients mainly come from the English-speaking countries, so in England,
Okay.
Ireland, the States, Canada, Australia, New Zealand. Even from New Zealand, they'll be travelling as well. I've got one from South Africa that's shown an interest as well.
Okay.
So they're just about from everywhere because they've actually got reps in Romania and Ukraine as well. So they deal with that side, and I'm just dealing with the English-speaking side of them. So that's where they're all going from. But by all means, all from Europe as well. If anyone's interested and they approach me from Europe, I'll be happy to help them.
That's brilliant. Okay, so tell me, why would, say, from the UK, why would someone go to Turkey? Why would they not just have surgery where they are in the UK?
Okay, so it's much cheaper in Turkey to have these done. I mean, the reason why it's cheaper over there is because the living standard over there is much cheaper compared to, say, UK or any other place really in Europe. For that reason, all procedures are actually cost effective over there. So not only they'll get their treatment done, they'll have a little holiday at the same time, pay for their flights, and they'll still have money remaining with them as well. And the outcome is always very good. They actually always deliver what they do promise.
Okay, so you said that you've been over there. The surgeons that we would be having the procedures with, are they just as qualified, say, as in the UK or anywhere
They are.
else?
They're all board certified. The hospitals operate in accordance with the National Accreditation System and are audited twice a year by the Ministry of Health to ensure quality, safety and service standards. Due to this reason, and then knowingly that they will be actually audited, they do keep up with all the requirements that's necessary for them. Due to this, they always deliver very good service as well. I've not heard anything bad from this hospital at all because I have done my research on them and they're actually very good.
Okay, so are you just working with just one particular hospital and one particular set of doctors?
At the moment, yes, I am, because this is the ones that I've actually looked in depth of to see what their work is like and their past history as well. I mean, to do for everyone, that's a very big scope, and I'll be taking a lot of responsibility in my hands as well. I've actually recently sent some of my clients over to them, knowing that I could trust these people to actually provide the outcome that these clients require. So I want to keep it small for now because I know their outcome and I know what procedures that they do. So that's why I'm actually promoting them only at this stage.
That's brilliant. So just tell me, what procedures would someone be able to go over to Turkey to get with this particular hospital?
Okay, the gastric bypass, like weight loss surgery, is actually huge, very huge, and this is a speciality area where a few of the surgeons there they're actually dealing with at the moment. So they're actually doing a big launch this week, funny enough, and it's a very good price as well. So that is what a lot of people are actually booking in for. Saying that, nose rhinoplasty is also very popular. A lot of people want to have their profile and their front face looking really good, and it just gives people that confidence that they actually want.
Yeah.
I mean, the weight loss is possibly more for health reasons as well, but there's other procedures like facelifts for nose, even the BLB, the Brazilian bum lift, or BBL, what they call it is. This is new to me.
BBL.
BBL, that is huge as well from America. I can't believe how many people have actually shown interest.
Brilliant. Yeah, it's true. Yeah.
Breast enlargements, reducements, they do all that as well. Tummy tucks, very good. I've seen the quality of the work and I've seen the outcome. This is why I put my name onto it, so I can actually trust them.
That's great. So tell me something I've always kind of wondered about. So how is the client going to know before they get to Turkey that they're not going to be refused surgery, especially something like with the gastric band procedure? How would they know that they're fit for the procedure?
Okay, so they do have a FaceTime consultation with the doctor. Obviously, the doctor doesn't see all the procedures inside of them. When they do get there, they're taken to their hotel the first day because they're obviously too tired to go into hospital. The following day, when they come to meet the doctor, they have a full consultation. If, however, they do find that there's something there that's not going to go right for them, they wouldn't do it. And if there's any money given, it'll be refunded, and they stay at the hotel for free as well. So it'll just be like a mini holiday for them in the end. It's only for their own health and safety, really. I mean, we don't want to go ahead with something that's not going to be suitable for the clients. They have to be fit for this procedure. Saying that, if they have gallstones on, like their bladder, or not their bladder, on their kidney, on their wherever it was in the body, they are actually alerted with this, and that's actually removed at the time of the operation as well. So, and we do actually highlight that this is what we're going to do, and they're normally quite happy for that procedure to take place as well, because in America that's an extra expense for them to have that done, whereas here they just have it done while they're actually having the other procedure done as well.
That's great. Okay, so so obviously Turkey, they're speaking a different language. How are clients coping with the language barriers? Is there any translators or anything like that?
They speak just about every language when you get there. They speak Russian, German, English. At the hospitals, we've got interpreters. I mean, the interpreters actually are there with them. If it was a Russian person going there, the Russian interpreter will be with them all the time, even when they wake up from their procedure. They'll be beside them, explaining exactly how the process went, all the way through to the hotel. And even in the hotels, there's people that speak other languages as well there. Even in the shops,
not too much of a problem.
When I go to the shops, they speak to me in another language.
So it's there isn't really an issue then with language.
There's not an issue at all, not at all.
Okay. That's great. So just give me like a brief overview of kind of what a client could expect from kind of start to finish, picking up from airports, things like that. How would their kind of package go?
Well, once they decide that they're going to have this procedure done, a date is set in place for them. I alert the coordinator over there, so she actually arranges for them to be collected from the airport, to be taken to their hotel. They stay at the hotel, they rest that day. The following day, they get taken to the hospital for a full consultation with the doctor face to face. They get to meet the other colleagues there as well that's working there, the nurses, the doctors. And normally it can start the following day or the 2 days after. Normally it is the following day though. They'll start their procedure. Once it's completed, they do request them. Depends what procedure they're going to have, that they do actually stay in Antalya for 7 days. So they can actually check them again. It's a good idea, and it's for their own well-being really if they did stay for 7 days. Once everything's okay, they're given the aftercare plan and they take that home with them. If, however, they have any problems when they get home, they can call not me, not the coordinator, they call the doctor directly. And it doesn't matter what time it is, the doctor will answer them and guide them what's needs to be done.
That's what I was going to ask you about the aftercare as well. But let's just say somebody, say they had a tummy tuck or something like that, and say 6 months down the line they wanted a revision. Is that something that they would do? You just have to go back to Turkey? Would that be?
If they want it, yeah, of course. Yes, of course, they can come back for revision at any time. I mean, some do, I believe, as well.
Yeah.
And it works for them. And I think because they actually build a really good rapport with the doctors as well, so they get to know them quite well, so they feel comfortable to do this in 6 months' time.
Yeah.
However, in 6 months' time, when they do come back, they decide to have another procedure with that as well. So that works out really well for them.
Yeah, to save up and have something else done whilst you're going back.
Absolutely.
That's great. So just the last question for you. Could you just give me some idea of the prices, you know, compared to maybe prices in the UK, compared to what you might pay in Turkey?
Absolutely. I mean, I know that one person was inquiring about the nose rhinoplasty this morning, and
Okay.
that's £2,000, and that includes your collection, the hotel, the
Wow.
accommodation, everything in there, and the care stay that you'll be staying at the hospital for a few days as well. Over here, that would be about 7,000-8,000
Okay, so
in
you're
the
making a big
UK. It's
saving.
a big difference. And another one is the one that we're having the promotion now for the gastric sleeve for the weight loss. We've got a very good deal for 2,500 at the moment, and
Wow.
that's up until, if it's paid until the end of this year, but they can have that surgery up until the end of March, anytime they choose, as long as they've actually booked the slot that they actually want to have it done by that time. So that's really good. Over here, I don't think you're going to get that for 2,500. There's absolutely no way you would
I
get
think
that.
that's
And
actually
not with
quite
the,
expensive.
it is not only it's very expensive over here, but also the service over there, I'm not going to lie, it is much better. The service and the care that you get, it's a one-to-one service you get. The one-to-one care, it makes a big difference for every patient.
Brilliant. Okay, Emma, thank you so much for talking to me today. It was great having you.
Thank you. Thank you so much for having me here as well. Lovely to meet you again.
Bye.